Hello, myself Dr. Vishal Pingalkar. I'm a consultant neurosurgeon in a Vishwa Neurospine Surgical Specialty Hospital, Bid. On the occasion of World Epilepsy Day, we'll be discussing about what the epileptic patients felt about the quality of life issues in their life. Epilepsy can be associated with profound physical and physiological and social consequences. And its impact on a person's quality of life can be greater than that of some other chronic conditions. A number of factors are thought to contribute to this, including the unpredictability of seizures as well as the stigma associated with it. Importantly, no two people with epilepsy are the same. Seizure severity, frequency varies greatly from person to person. Research suggests that increased seizure severity can be negative impact on a person's quality of life, contributing to anxiety and social behavior. Impact of epilepsy. The impact of epilepsy on quality of life can be substantial with far-reaching and lifelong consequences. There is now growing recognition that when assessing the impact of epilepsy, patients and physicians should look beyond counting seizures. Key areas of quality of life influenced by epilepsy includes: first is education. Often children living with epilepsy receive inadequate schooling. Children of average or above average intelligence who were living with epilepsy had at least 2 years of deficit in reading skills. This significantly lower educational performance could be attributed to cognitive impairment caused by the etiology of epilepsy itself, the frequency of seizure activity, and the effect of anti-epileptic drugs therapy in people with epilepsy. Cognitive impairment can take various forms, but most commonly are memory impairments, mental showing, and attention deficits. The second impact caused by epilepsy is employment. Unemployment levels are disproportionately high for people living with epilepsy, approximately 2 to 3 times greater than the general population and higher than seen people living with other disabilities. People with epilepsy are more likely to experience problems in identifying a job than the general population. This contribution of institutional and social restrictions often results in people with epilepsy underperforming compared with the general population at the workplace. Independence. Many people with epilepsy experience problems with physical disability which may limit independence. The fear of having seizure, cognitive consequences of epilepsy, and treatment. And ineffective treatments also hinder independence. And inability to retain a driver's license due to uncontrolled or breakthrough seizures adds to limitations. And restriction experienced by people with epilepsy throughout their life. Driving is a key issue that can have a detrimental effect on the lives of people living with epilepsy. Effective seizure control may enable people with epilepsy to drive, increase their level of independence, and ultimately improve the quality of life. Social isolation. Many people with epilepsy hide their conditions from others, which can result in a social isolation and reduced self-esteem, and can lead to a feeling helplessness and depression. Together with the social stigma that persists in some parts of society, people with epilepsy often feel a sense of social isolation and have overall reduced quality of life. Social isolation and quality of life have also been shown to significantly compromised in caregivers of people living with epilepsy and demonstrate extent to which epilepsy can impact the quality of both those living with but also caring for the condition. Thank you.